Hello, and welcome to Keynote. I'm your host, Elizabeth Moore. In our May episode, we explored the link between high blood pressure and cholesterol with primary care physician Dr. Mary Gover. In this month's Keynote, Dr. Gover talks about alternatives to statins and why they might be a better fit for some people managing high cholesterol. You had mentioned earlier non-statin cholesterol-lowering medications. Can you explain what those are?
Yeah, so there's one really common one called ezetimibe, or Zetia is the brand name, and it also helps with cholesterol synthesis and metabolism. So oftentimes, ezetimibe can be used in combination with a statin. There are two ways it can be used in combination with a statin. One would be if you have a very high risk of future cardiovascular disease and statin therapy is not enough to lower your risk, that can be a risk-reducing multiplier. You can add that on. Another way that it's often used is in people who want to take a lower dose statin but also want lower cholesterol. So you could have a lower dose statin plus ezetimibe, and that can give you bigger bang for your buck with the statin if you're trying to keep yourself on a lower potency statin, particularly for those with muscle-associated side effects.
And so you can take the non-statin medication on its own. And
you can take it on its own.
And that will help.
It's less potent. Statins are much more potent than ezetimibe, but you can absolutely take it on its own if that's what will work for you. There's another non-statin medication called a PCSK9 inhibitor, which is an injectable medication, which is actually extremely potent, often reserved for those with what's called familial hypercholesterolemia, or very high levels of cholesterol because of a family predisposition, talking levels above 200, closer to 300s, 400s of your LDL. It's very effective at bringing the LDL down. It's a subcutaneous injection every 2 weeks. You can give to yourself or you can go to your doctor for. You can also give the PCSK9 inhibitor injections to people who are statin intolerant.
And is that something you would be on for a period of time, just like a statin?
Exactly.
Okay.
All of the cholesterol medications are thought to be chronic medications or lifelong. There could be instances where people come off a statin, particularly if there are a lot of lifestyle changes that could occur for that person that haven't happened yet. And if they make those changes and their LDL is low without the statin, you could do a trial off of the statin, then you could certainly come off of it.
For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.